This is Marisa, Lavine, and Danielle is here with me. We're going to go ahead and get started and move through this, so thanks for bearing with us. I'm excited to talk to you about our Love Your Sweetheart campaign. As Sandra mentioned, we are both with Adventist HealthCare. I work as the Associate Vice President for Public Relations and Marketing at a system level, and I've been with Adventist for about 10 years. And Danielle is here. She is our Manager of Public Relations and Marketing with Washington Adventist Hospital and has been with us for about 4 years. So we will keep going. I want to first kind of give you some background on our Heart Month, well, first on Adventist HealthCare, and you can go ahead actually and skip to the next slide. A little bit about Adventist HealthCare. We are based in Gaithersburg, Maryland. We're an integrated healthcare delivery organization. We're the first and largest health system in Montgomery County, Maryland, which is right outside of Washington, D.C. We have 2 acute care hospitals in Maryland, Shady Grove Medical Center and Washington Adventist Hospital. We have a behavioral health division. We have a rehabilitation, home care, several physician networks, urgent care centers, and a robust community wellness program that provides education and screenings to our community. Cardiac care is extremely important to our system. Washington Adventist Hospital was one of the leaders in providing heart care to the community, one of the first providers of open heart surgery in the area more than 50 years ago. So our focus on Heart Month in February and our cardiac marketing has been very important to our team and to our organization. We can go ahead and skip to the next slide. Just to give you some background on our Heart Month activities, we really started going, if you kind of go back and look at how we focused on Heart Month related to cardiac services, we started actually, when I joined Adventist HealthCare, we were part of a larger event down in Washington, D.C. called Sister to Sister, and we provided a lot of free health screenings, cholesterol screening, a number of other free services at that event. And what we started to see over time was that it was a great event, it was a huge event, but it really wasn't attracting members of our target market. We weren't reaching our target audience and those that would potentially use our services. So back in 2010, actually a little before that, we started to look at moving to an event that was more in our service area. And that's where the Love Your Heart program event grew out of. And what that, from starting in 2010, we put together, it was a heart education and screening event. So we did free heart health screenings. We didn't the first couple of years do cholesterol, but we eventually started doing a finger stick. We did sleep apnea. We did body mass index and a number of screenings related to heart health free. In addition, we did an education part of the event where we had physician talks and a number of other activities, cooking demonstrations, exercise demonstrations, really all related to heart health. So we did this actually, and you're seeing the 2011 through 2014 data on this slide. We really did the first couple of years at a mall called White Flint Mall, and then moved it, and that's where you start to see a jump to a larger mall that we were in a partnership with, actually, Westfield Montgomery Mall. And that's where you really see the jump, because it was just a higher volume mall. We had more opportunity to engage more people in the event. The event really, based on the space in the mall, the time frame, was really, we were really able to handle about 300 people in about 3 or 4 hours in terms of our screening. And that's really who we could track. We could track them if they came through our screenings because we would get them to register, we would see who they were, we could follow up with them. But those that would just watch the stage area, that kind of thing, it was visibility, but we didn't necessarily always know who they were, and we couldn't track them and follow up with them. And so we were averaging about 300 people. We were spending about $24,000 a year on the event in terms of promotion, screenings, all the materials, supplies, all of that, plus staff time to plan the event. And it was months of planning that went into it. So for this year, we really took a step back as we started to think about 2015 and said, can we do more? Can we reach more people for the same money or, less money per person in terms of our acquisition costs? Can we rethink this as the world of marketing is we're looking online and we're trying new strategies, and we have been marketing our heart risk assessment, our profiler with Medicom. Can we tie that in and do more with that? And so we really started to rethink our strategy around Heart Month and Love Your Heart. And that grew into Love Your Sweetheart. So I'm going to hand it off to Danielle to tell you about our change for this year. And you can skip slide.
Yep, next slide. Thank you. Yep, so before we jump to Love Your Sweetheart, we just also wanted to provide you with a couple of examples of the different ways we had been promoting the HRA. So historically, we tried a number of different channels over the years, everything from mall banner ads to Metro Bus and Metro Rail ads, and you'll see some of those examples there. And historically had been tied to our promotions around Washington Adventist Hospital throughout the month, Heart Month, and then also throughout the year. So we can skip to the next slide. So moving to 2015, again, like Marisa said, we took a step back and we wanted to take more of a system-wide approach and, again, get more targeted with the people we were reaching. So ensuring that people who are in need of our cardiac services were coming to us and we were reaching those folks. So Love Your Sweetheart was an integrated marketing campaign and targeted outreach strategy where we incentivized individuals to take the HRA and also get a loved one to take it. So throughout the month of February. So again, trying to increase our reach in the amount of people who we were engaging in the tool. And so if both the individual and their loved one completed the HRA within the month of February, they were entered into a raffle to win a spa day for two. And you can see there some of the components of our campaign, which we're going to dive into in the next slides. But first was our digital and social media strategy, and that is what really helped us reach a great deal more people in a more cost-effective way. We also worked on targeted direct mail with our CRM system, Tea Leaves Health, and that helped us get much more targeted. So again, reaching people with a high to extreme high risk cardiac risk. And we held 2 heart health screening events, so smaller events held in each of our hospital's service areas, and mirrored a bit off of Love Your Heart, but again, attracting those folks with the high to extreme high cardiac risk. And our partnership with WTOP Radio continued, and they actually were able to donate our raffle prize through one of their clients, Red Door Spa, and threw in some heart promotions for us as well on air and online, which we're going to talk about. So you can go to the next slide. And so first, our work with the digital and social media strategy, we worked with a company called Bright Whistle to do targeted Facebook ads, which pop up on the user's news feed. And you can see there on the right, that's the landing page that they built out for us. And so all of the individuals that saw our Love Your Sweetheart promotions were then pointed to this landing page to enter their name, email address, and loved one's name. So we were able to collect email addresses right out of the gate. So even if they didn't move through to complete the HRA, we captured their email right there. And you'll see there our first, this was the initial Facebook ad that we started with. And another great thing about working with Bright Whistle was they have a really user-friendly dashboard. So throughout the duration of the campaign, we were able to monitor how many clicks, and we were noticing that this ad was a bit underperforming. So we have a team of 2 really great digital gurus here who were running some boosted Facebook posts at the time. And if you click once, you're going to see, if you just click on that slide, we have, okay, there was an animation that switched over to the next ad. So we switched it up. We ended up switching up the creative there to focus more, thank you, there it is, on the Red Door Spa prize, because we were noticing that that was much more engaging and much more successful. So once we did that, we saw some really great results. About a week after swapping in that creative, clicks went from 596 to over 1,000, and we saw HRA leads generated from that ad went from 18 to 90, and then HRA completions went from 8 to 48. So again, really successful for us there. And another good strategy that we used, we were noticing that people were coming in to the landing page but not moving through to complete the HRA. So the Valentine's Day holiday was coming up, and again, our team came up with an email to push out over the Valentine's Day holiday as a reminder, enter in, get your loved one to take the HRA, and again, playing up that Red Door Spa prize. And that, again, was really successful for us, and we saw by pushing that out, we had 111 HRA completions over a 3-day period. That was, again, another something that we found to be successful. You can go to the next slide. And our targeted direct mail, as I mentioned, we worked with our CRM system, Tea Leaves, to mail 30 to 36,000 homes in our target area. And the creative there is what we use to promote the contest. And then we also ran 2 smaller targeted direct mails inviting people to our heart health screening and education events. And we can go to the next slide. And those events, as I mentioned, we did mirror them off of our Love Your Heart event. We offered the HRA on site. We had expert chats with our cardiologists and heart health experts. We delivered screenings, had cooking and exercise demonstrations, and some fun Heart Month prizes and giveaways. And so in total, I think those events attracted a little over 100 people, so smaller than Love Your Heart, but also much more targeted. And go to the next slide. And there's a picture there of our Love Your Sweetheart winners. So at the end of the campaign, at the end of February, we drew the winners through a raffle, and the couple there ended up living in Silver Spring, which is near to our Washington Adventist Hospital. So we invited them on site. They received the gift cards and also the opportunity to talk with one of our cardiac nurses about their HRA results, and she was able to answer any questions that they had at the time. And you can move to the next.
So the only other thing, and we will share this afterwards. There was also we did a video with the HRA winners, and a short video that we just produced it to talk about the HRA, talk about the winners, how this made a difference there. So that was another piece of the campaign. But we want to talk a little bit about the results and what we saw. And I mentioned this earlier. It really comes down to looking at what did we spend on the event, and we really set out to reach more people and do it for a lower cost in terms of our acquisition of patients. So we're able to use our CRM system, or Tea Leaves, to help us evaluate some of this and understand sort of what are we spending, what does it cost, and I'm going to show you some of the other data. But at the end of the day, our Love Your Heart event, when we looked at a single event, it was really consistently $24,000 a year. And we were pretty consistent at grabbing 300 people through that event. So it gave us about an $80 acquisition cost for those participants. When we looked at Love Your Sweetheart and we looked at our total spend, which was $36,000, but we had more people. We had 548 HRA completions through the Love Your Sweetheart program. It was about $65.69 per acquisition. So we brought that cost down. Even though we ultimately spent more money, we reached more people, and the cost per person was lower. So we consider that a success. You can skip to the next slide. To give you just some information that we were able to see for this, actually, Danielle, I'll let you kind of jump in on this one.
Yeah, so just to give you a little background about our HRA takers, you can see the demographics there and how they heard. So the 26% showing our success working with Bright Whistle on those targeted Facebook posts, 26% cited online ads and social media. Our success working on those targeted direct mail pieces, 24% cited direct mail, and again, that Valentine's Day email push, 17% cited email. And we also took a look at HRA engagement through 2014 compared to 2015, and you can see that our visits more than doubled and our completion rates quadrupled. So this was a really successful campaign for us in terms of the amount of people we were able to engage with during that 1 month period.
You can skip to the next slide. So at the end of the day, this is one campaign, and we look at measuring this in a number of ways. And one of those things is looking at it over time. And I definitely want to preface this and say, it is a little early still for us to start measuring this in terms of how these people that took our HRA, participated in this event, have come back, because some of them still may not have had a heart event or a health event coming to one of our facilities. So it's definitely something we're going to watch moving forward, but we're certainly looking initially at some data, and I wanted to share that. Both in terms of we're monitoring monthly. We're looking at what's happening to these people. We're using our Tea Leaves Health system, our CRM system, and we do have a direct feed going from the Medicom profiler into Tea Leaves, so we can see that on an ongoing basis to watch what's happening with those people. Are they coming into our system, or how are they coming into our system, and that type of thing. You can skip to the next slide, and I'll show you some of that data. So just looking at our HRA, and this goes back through January, which there was still some campaign build up in January, so we go back through January. We had 17 distinct individuals that we can see that participated in our HRA come back into our system and use our services. The total charges, and right now our CRM measures total charges, were $128,000, and the average total charges for those patients were just over $6,000. Most of those people coming through were majority women over the age of 45, so very similar to our target heart consumer. We had about 71% white patients. We did have small percentages of Asian and Hispanic patients. Generally, we're seeing that they're highly educated professionals. Many of them are making over $100,000 a year. And they're coming back to us for primarily outpatient services at our 2 hospitals, a lot of lab and radiology. And what you can also see here, which we pulled from Tea Leaves, is our financial class, the breakdown. So we've got highly insured. We do have some Medicare patients, which, skewing a little older, but you can see more Blue Cross commercial insurance coverage coming into us. You can jump to the next slide. And, this is, again, as I mentioned, this is a little early to watch this, but one of the things we watch in a campaign through our CRM system is that touch point response per month. We watch month over month what's happening. So what you see there, where you see the arrow, is where we had our campaign. It started to pick up a little bit at the end of January, really ran solid through February. So again, we're only seeing a couple of months. We do want to watch this over time, and some of what we need to do is watch how we continue to follow up, and we'll talk a little bit about that to see, do we continue to engage these people that have now come and taken our HRA. But we're starting to see the numbers go up, and we like that. We want to start to see that upward trend. But I just wanted to share kind of how we'll be tracking this. And you can skip to the next slide. So we also looked at our direct mail piece, which again promoted the profiler. We did about 36,000 pieces. We had about 846 responses out of that campaign. I can see this through Tea Leaves. About 846 of those people have come back to us for care, come into our system for care. 687 were already patients. So that tells you we've got a really strong response going from people that have already come to us, took the HRA, and now they're coming back. But again, we had 108 friends and family, and what that means is those are people that have maybe used our services, come to a screening, come to an event, but they haven't actually been a patient or come to us for care in one of our facilities. 51 of those people that came in were pure prospects. They have not come to us for care in the last several years, going back into the beginning of our CRM. Again, that demographic skews a little older, 55 or older, which is interesting and not surprising from a direct mail standpoint, that we're going to see a little bit older audience, similar breakdown in terms of ethnicity. What we're seeing in that group, 36,000 pieces, total charges about $5.5 million since January among that group that has come, that we mailed the direct mail piece to. So again, taking it back to the total cost of the campaign and seeing those total charges, we feel good about that. And we're seeing of those people, about half of that was outpatient services, things like lab, radiology, 30% were emergency department, and about 20% were inpatient. And again, that graph at the bottom really just shows the strong response from those that have already been patients, really showing that opportunity that we have to really engage those that have already come to us for care, bring them back in, really looking at something like a population health strategy, bringing them back into our system. You can skip to the next slide. What this shows you, again, going back to direct mail, is our overall engagement, the response we're seeing, and it shows you really just in a graph form. If you look, this same group where they were back in January, and what you were seeing, where you see the blue, that bottom section, those are patients. The darker green, they're friends and family. The lighter green is pure prospects, and you can see that increase, that growth in terms of their engagement with us. And again, we want to keep seeing that. We want to see that go up, but that's one of the ways we watch it in the Tea Leaves system. As the months go on and our data updates, we start to see more and more of those, and our goal is to always see that increasing over time. You can skip to the next slide. So again, just looking at the two approaches, and we really went back and said, okay, was this the right strategy? Was this the right way to approach this event, Heart Month, and how we promote Heart Month and tie it into our bigger project? And when we looked through our CRM system, when we looked at Love Your Heart, we really saw low engagement from those people that participated. They came to us, they had a free screening, and yet only 2 of them from our 2014 event, 2 distinct patients came back for care. Total charges of $10,000. When we looked at just our mailing that we did for February, we had already had over 636 people. We had had $4.3 million in charges just from that one piece. You can skip to the next slide.
Great. So another benefit of the integration of our HRA into our CRM system, TLEAS, is the ability to identify really powerful patient stories. And how we did that was we worked with TLEAS to pull a list of someone who we wanted to find someone who had taken the HRA and then became a patient at our hospital. And so we also worked through our compliance officer, ensuring that we were complying with HIPAA rules and regulations there before reaching out, and came across Toby Weiss, who you see pictured there. She had a pretty incredible story, had no known heart disease risk factors, came across the HRA that gave her high heart risk results, and around that same time she was feeling a little bit off. She had some neck pain, some nausea. After taking the HRA, really made her kind of question her health, and so that prompted her to call her doctor, and in doing so they found some very severe heart problems, and she ended up requiring bypass surgery at Washington Adventist Hospital. So she is healthy and doing really well. We featured her in our spring magazine, and she cited that having come across the HRA as a huge benefit to her, and what really did prompt her to call her doctor, and was really grateful that she had come across that. So again, just a powerful way to share the importance of keeping heart health top of mind and the value of the HRA. You can go to the next slide. So here are some of our follow-up campaign and next steps. So our work isn't done. Our team took a lot of time to strategize and brainstorm around different ways we wanted to continue to engage with the HRA takers. And again, we don't have all of the answers, but wanted to share some things that we've come up with and tried so far. So our first priority was, after collecting all of their information, engaging with the moderate to high risk group. So making sure that we're following up with them and connecting them to health resources. And what we did was we were able to arrange for follow-up calls to be made to everyone falling in that category. We worked with a project manager in one of our employed physician offices to make those calls, and if those who were interested, she would be able to schedule an appointment with one of our primary care physicians. And she also shared with them some of our community health programs, and the individuals whose phone numbers we weren't able to collect falling in that category received the email that you see there, which was a personalized email alerting them of their risk, and then some follow-up next steps, talking to their doctor about their results, either ways to find a physician, as well as the opportunity to talk about their results with one of our nurses by phone. And we also kind of listed out there some of the ongoing engagement strategies that we're working through to engage with the entire HRA group. And one strategy that we definitely want to capitalize on, which was mentioned earlier by the Medicom team, was all of the customizations available now. So sending out targeted emails to people who have a physician versus those that don't, taking advantage of the risk stratification emails. And we've also been feeding in all of the HRA takers into our monthly e-newsletter. So again, continuing to follow up with them and share information about our health programs with them, even beyond just the Love Your Sweetheart campaign. And continuing to use that list to reach out to them regarding any community heart health events and programs that we have to offer. So that kind of brings us to the end of the presentation. Wanted to open it up to see if anybody had any questions for us.
This is Sandra. I actually have a question, but I'm going to first address a question that came in from one of our participants. So for someone without a CRM system, did you calculate ROI prior to your relationship with tea leaves? If so, how?
I will tell you, prior to having our tea leaf system, it was extremely difficult. I think at one point, one of our team members had literally tried to go through individual lists to match up, one campaign participants to a list, and I mean, it was literally a job that was done by hand. We didn't have a solid way to do it, and we tried a number of approaches. Putting in the Tea Leaves Health System, which was definitely, it took a long time to get the approval and get that in place internally. That has changed our ability to do that. It has really made a difference in terms of how we market and also how we can measure.
Great, thank you. Another question came in. What were your calls to action for your profiler, and where did you want to send your user? Are you sending them to a microsite, or how are you handling that?
I'm going to let Danielle take. I'm going to let Danielle take that one.
Sure. So within the profiler, we typically spotlight the opportunity to our Find a Physician hotline, which is a free referral service, so a way for them to call in to find a doctor. And we also have the phone nurse consultation. So we have a nurse who, the opportunity to connect with one of our nurses to review all of their results, and she also has information available about all of our community health programs and puts them in touch with any of those programs that might be applicable to them.
Great, thank you. A reminder to those out there, you still have time to submit some more questions. I'm going to ask one while we wait for additional questions to come in, but just use the chat feature that you can see on your screen. Here's my question. When we're dealing with our clients, I often get asked if there's ever been an adverse reaction to doing those phone call follow-ups to your moderate and high-risk patients. Have you guys ever had any experiences like that, or are people generally welcoming those calls?
We were nervous about that ourselves when we started that approach, but so far we've had nothing but positive feedback from the individuals who received the calls. We have been, no one was, anxious or uncomfortable in receiving the call. A lot of them were interested in hearing more about our services. We haven't yet scheduled any primary care physician appointments, but everyone was we didn't receive any negative feedback there, but that was a good question.
Perfect, I like to hear that. I have another question. Any lessons learned or anything takeaways that you would do differently or recommend to our current clients that might be helpful? And if I put you on the spot.
No, I would, this is Marisa, and I would jump in and say, I think, and I think we've learned this from this and from our other campaigns, I think looking at an integrated approach. I think a direct mail alone isn't always great, and digital alone, but we really looked at how do we integrate this? How do we approach this in a number of different ways? We had the events, we had the direct mail, we had the online, the Facebook, and we had the digital components, really kind of pulling that together, because I think that's where we saw it work, and we can measure each individual piece and obviously look and adjust and do that, but where we've seen that success is trying those different approaches and using that integrated approach. You can see we reached slightly different audiences. Older demographic with direct mail, younger on online. So it just, seeing some of that. But I think that's really important, and that's something that I would look at again. And then looking at what else can we do to really reach more people, take it to the next level for next year. Anything you have?
I would just jump in also to say how offering a prize incentive too throughout a campaign is very, very important. I think we've seen our numbers rise significantly when we offer a prize for individuals, especially one that's attractive and that is attractive to kind of people at many different ages and both genders.
Awesome. You just answered a question that someone just sent in. They asked if, did you find that this campaign performed better because of the incentives? So thank you for asking that.
We've seen that. just here, but also in other campaigns and I think that this one was a particularly attractive prize, and we really thought about what it should be. We've done iPads and Fitbits and that kind of thing, and that's great. But this prize, the Red Door Spa, they have several locations in this area. It was not just, a $50 gift certificate. They received two $500 gift certificates to the Red Door Spa. So it was really significant. And it was great because we worked with our partner WTOP Radio, and they were able to bring that partner in, so it really worked out well.
Awesome. Another question came in. Can they view the Toby patient story anywhere online?
Yes, absolutely. The story is up on our blog, and we'll make sure we send out a link when the presentation materials are sent out. And we also have a video too spotlighting her story, so we'll make sure to include those.
Perfect. If anyone else out there has a question, feel free to send it in. We'll wait here a few more minutes, but right now it looks like we've addressed most of them. But while we're waiting to see if any of the questions come in, I just want to tell you guys, you've done such a great job. I really appreciate the thoroughness of how you not only planned your campaigns, but measured, and then what you learned from them. And I think this will inspire many of our clients to take a look at their current campaigns and hopefully kind of re-energize them and learn from it. I was really impressed too with, I was looking at some of your slides, the digital piece. It looked like you had a lot of responses to that, but as you mentioned, you need a multifaceted campaign. That direct mail piece did extremely well, and it was interesting to see how you had different results from the different campaigns. So it looks like we're done with questions. That doesn't mean we cannot still address questions after this is over. Oh, no, never mind. Another one just came in here. How important do you think it is to integrate the Avalia profilers with existing marketing efforts and not treat it as a standalone digital strategy?
So I think it's really important. I mean, we're really looking at this, when we do our marketing campaigns, we can put an ad out there and people see it and they'll see a bus or they see something and they see it's great, but how do we measure that, whether someone who sees that bus comes back into our organization? And we're really looking at how do we put something out there that engages our consumers, engages our audience, and we can track who they are, stay with them, keep engaging with them so that when they have to make the choice for a doctor, a hospital, urgent care, whatever it is, home care for a loved one, they come to us. And so we really like that we're able to integrate it, it isn't just a standalone digital strategy. It's in our direct mail. It's in our print ads. As you saw, Danielle, that was part of our marketing campaign. But what we did in this case is we took it up to our Heart Month strategy, which we already are thinking around Heart Month, but we kind of made it the focus. And in this case, we sort of took a 2-for-1 approach. We want to get one person in, and then they get a loved one in. So that was. We think it's really important, and we've seen the success. We've seen the change. As I showed you, the acquisition cost to get someone to engage with us was less, and we saw stronger results, higher numbers.
Great. This is Sandra again, because I have another question. I'm so inspired by what you guys did. How has your C-suite been informed of your success, and have they been supportive, and has it resulted in any benefits on your end from having a measurable campaign?
So as I mentioned, we're really just seeing results. So you're seeing some of the first results from this. I mean, we've done, I think, a little bit of sharing, right, Danielle? We did just some initial, some of our cardiac leadership. But we definitely, we always want to make sure we have good measurements and enough time to truly measure before we go too far. So this is something we'll definitely be sharing. But they've so far been excited, and the Love Your Heart event that I talked about was very visible. We had a lot of our executives, a lot of our C-suite team coming out to it to see it, and they liked the visibility in a very busy mall. And so this was, we were delicate on this in terms of making sure people understood we don't want to lose something, but we think we can do more and reach more people, because at the end of the day, we wanted them to engage with us and select us for their care. So that was, we handled that delicately, and it was actually, there was a lot of support for this change in strategy, and we showed the numbers. Teeley's luckily let us see what was happening with all these people year over year that came to Love Your Heart. They weren't coming back to us for care. We could see that. They were coming to us for the event, and we weren't seeing a lot of return. And so we're already seeing stronger return here. So there's generally support for that type of change.
Perfect. We just have a few minutes here left, so I want to respect everybody's time. If no other questions are coming in, I'm just waiting here for another minute. We will end our presentation. I'm very excited to share this with other clients who are unable to make it on the call today. So really, I appreciate all the prep you did to make this a great story, and then your results are just amazing. So thank you both to Marisa and Danielle and everybody involved in making this webinar happen today, and thank you to our clients. We really appreciate your business. So you'll be seeing a follow-up email from us that'll contain a recording and the presentation. If you have any questions, we have a list of all your contacts here. Feel free to connect with any of us, and we'll be sure to help you out. So thanks again, guys. We really appreciate it. Great presentation.
Thank
Bye,
you.
everybody.